Maverick Physical Therapy. Just I'm a little bit older and maybe a little retired from some throwing sports and stuff like that. Still love to get on out there and wing the old pigskin around with some buddies that come on into town, and love to get to some of the local high schools that have the outdoor racquetball courts. Sling the old racquetball around, the old paddle, and play a little kickball, a little dodgeball, throw the old ball around a little. So today we're going to be talking a little bit about the preparation of the old rotator cuff. Man, what a hot topic that has been over the past several years, the past 20 years. We've been really told by a lot of quote-unquote experts, like your Job and your Yoakum, Dr. Job, Dr. Yoakum, and a guy like Tom House on the baseball side of things, that really have things figured out, man, and really have things keyholed in terms of, hey, this is what you have to do for your rotator cuff, and this is going to prevent injury. Well, guess what, guys? The news for you is that in all of professional sports, we're seeing more injuries, and recreational sports and amateur sports, more injuries today than what we have ever seen in the history of sports, competition, and athletics, and particularly for the throwing athlete, shoulder and elbow injuries. So, I don't know about you guys, but when I continue to, life in general, get results that are unfavorable, and I continue to do the same thing over and over and over again and get the same thing, I think it's pretty ludicrous. And what we haven't been given, or what we haven't been told over time, is really the truth. Unfortunately, these gentlemen are guys that are good in certain areas. So Job and Yoakum over the years, and Dr. Andrew, they're good pertaining to their surgical intervention. What we need to remember, guys, is that they're medical doctors, they're orthopedic surgeons, they're specialists in knowing how to perform a certain technique via surgical intervention, and they know how to go through their best exam findings to produce and elicit a form of a pathological state that tissue has gone through via imaging, etc. What they're not good at and what they're not experts in is in specifically the rehab process, and more importantly and specifically the biomechanics of functional motion of the human being. Tom House supposedly worked with, he was the pitching coach for the Texas Rangers quite some time ago. Nolan Ryan was Nolan Ryan. You're not making Nolan Ryan better. Nolan Ryan made Nolan Ryan who he was, and this is out of the man's mouth himself, Randy Johnson, that Tom House had very little, if anything, to do with any kind of success that Randy Johnson has ever had. Best left-handed pitcher in probably in all of baseball's time span up to this point. So I'm gonna take you through a little preparation. I need to get these old rotator cuffs, man. I need to get these guys stabilized. I need to get them going, right? So I've got a couple little guys, Maverick and Maddox. So I should probably slow this down a little bit. And he's probably looking a little bit familiar to some of you. What I'd like to say is that, first of all, I was shared with a lot of these exercises several years ago, probably 20 years ago now, if not more. I was given these exercises as a way to, out of love, to help me be a better throwing athlete, to protect me, if you will. So I no doubt in my head, they were given to me by individuals that really did love me and care about me, and were sincere and genuine about me. A lot of great friends. As I spent 6 years as a strength and conditioning coach and a rehab expert with the Minnesota Twins, had a lot of successful people that perform these little guys on a daily basis. In fact, at the minor league level from AA below, it was 100% mandatory for every pitcher every day to perform these before they stretched and then before they threw. And then in the bullpen, during games, this is all guys would do. Just play around with these stupid little weights and these stupid little tubes and stuff like that. Seen guys such as Johan Santana, Francisco Lariano, and R.A. Dickey, Joe Nathan, Jesse Crane, several guys that have been very successful for several years, Kyle Loesch, that have been very successful for several years at their craft and their skill, but definitely not optimizing their efficiency. Professional athletes are one thing, amateur athletes are another. Professional athletes and good athletes in general are fantastic at adapting and super good at compensating, sweeping things under the rug until they get nailed later on down the road. Every day, man, these manual resistance exercises on the table, standing up. They were told these will protect your shoulder, they'll make you throw harder. There's nothing like ratcheting things down and isolating things. Oh yeah, then once you get your small dumbbell stuff done, do your tubing exercises also. Ratchet it down a little bit more. We're going to talk in this episode of the Rotator Huff, meaning the rotator hybrid of hip and cuff, and Rotator Thuff and Scuff, rotator thoracic spine cuff, rotator scapulothoracic cuff. What actually is involved and is required of the rotator cuff as we throw an object? We have an anatomical based system in higher education that has been set up and built off of cadavers. Back in the 40s and 50s, we had individuals that, and before that, really started to investigate the mystery, the gray area of the body. We had in the 50s and 60s all these machine weights and equipment that were developed based upon the anatomy of a dead body, meaning, hey, let's open this thing up. Let's take a look at the hip. Let's take a look at the connective tissue to make someone stronger, more stable, to be more involved in the rehab process. A lot of this took place by one by the name of Florence Kendall back in the epidemic years of the polio crisis, in which manual muscle testing was intervened for assessing isolated muscle function. When we look at the rotator cuff, we look at 4 different little muscles, tiny little guys that make it on up. Speaking of kind of the subscapularis, that will run from the subscapular fossa, that front part of the old scapula there, and go to the lesser tubercle. We have the greater tubercle on the humerus end if we're looking at the left arm. Supraspinatus fossa is the top guy, rolls underneath the subacromial space and attaches to the greater tubercle. We've got bursa sac under there, the subacromial bursa. Subdeltoid bursa, we've also had the long head of the biceps that is going to the supraglenoid tubercle right there. 8 millimeters of space underneath that subacromial arch. When the body's at rest, we're also going to have some episodes on impingement. We're going to really try and bring some clarity here, guys. The infraspinatus tendon, infraspinatus fossa, wraps around to the greater tubercle, kind of on that lateral humerus there. And then we've got the teres minor, inferior border of the scap, greater tubercle as well, of the humerus right there. So we're taught in school, we're taught via rehabilitation protocols, and we're taught based on what we've been regurgitated and passed down from person to person without questioning this crap, is that, hey, the supraspinatus tendon and muscle is only designed to abduct and externally rotate. The subscapularis is only designed to internally rotate the glenohumeral joint. The infraspinatus and the teres minor are only designed to externally rotate. So with these stabilization-like mechanisms designed to prevent rotator cuff-like tears, anatomy of the rotator cuff, there's this infiltration of these four tendinous-like structures into the glenoid humeral joint capsule, which is also a meshing of the long head of the biceps tendon. So you have this big glob of tissue right here that via these exercises not only provides, the word I like to use is called a little fast stability, a little fake stability, in that we get this false sense of stability due to what I've had guys tell me before is, you know, like this tightness and this control and this stability from really winding up these little tissues that we oddly enough think that they're so involved in the movement process of throwing an object, which is so ridiculous to me. When we look at some of these principles right away, if we're set up really well, really solid in terms of our biomechanics, with the principles of human function, and also strategies and techniques, we see that at the root of motor development, motor skill development, and motor learning is what we call this chain reaction. We've talked about this in several episodes in a variety of things, in that we have this proximal stability for distal mobility, or this proximal acceleration for this distal mobilization. And the best thing that we can do in regards to thinking about that is like a slingshot, a rubber band, or this whip-like structure. As we're throwing an object, if I'm playing dodgeball, a ball rolled off on me here.